Good evening. I'm Lee Bewley. I'm the program director of the Master's in Science Health Administration program here at the University of Louisville. The time is now 6 o'clock. We have this session recorded for folks who may not be able to join us at 6, or that they might not be able to join at all, but they had plans to attend, and they can review this session in a recorded format. Of course, you are here as well, and you can go back for any review of our presentation content. The way the evening will go, I have a brief slide set that addresses a lot of the questions that we receive from students or applicants over the years, some of the highlights of the program, probably take just 10 or 15 minutes. And then I'll open up the floor for any questions that you may have. So welcome. All right, let me start the session. All right, can someone confirm you see the slide sets?
Yep, I didn't see him.
Okay, thank you very much. Again, I'm Lee Bewley. I am the program director. I'm an associate professor at the University of Louisville. I currently serve as the regent for the state of Kentucky's chapter of the American College of Healthcare Executives. In that role, my job is to represent healthcare executives across the Commonwealth of Kentucky at the National Healthcare Organization for Healthcare Executives. I also provide support to the students and resources for our students that are interested in following careers as healthcare executives. Okay, I'm going to dive into our program, but a general question we have for many folks is why health administration, why a career in healthcare management, and what do health administrators do, and how can they provide value in the workplace? In general, the perspective is rooted in the fact that we spend nearly 1/5 of our economy on healthcare and healthcare delivery. Those resources are substantial in a multi-trillion-dollar economy, but matched against the perspective that in terms of outcomes and access to care, we are a few notches behind countries across the world that have similar economic and social systems. And so, strictly speaking, an opportunity and the responsibility of healthcare leaders, healthcare executives, healthcare administrators is to more effectively and efficiently use the resources that are provided within our system, within our health organization, within our clinic department, to be able to achieve higher levels of outcomes, both for patients and communities, but also from an organizational perspective. And so that's the work of a healthcare leader, healthcare manager, is to take the resources that you have and use them to the most efficient and effective opportunity. And there are substantial opportunities across our marketplace. A general pragmatic perspective, Bureau of Labor Statistics holds that the median income of a health administrator in the United States in 2024 was $118,000. It's materially higher than the median income for a family across the country, and definitely in our general metropolitan and geographic area. And the rate of career growth into positions is growing at a rate higher than the national average at 29%. And so we have an opportunity to serve more effective and efficient utilization of resources, the career prospects, and that median income, of course, is in the middle. And so folks might start off careers somewhat less than the 118,000, and for those folks that advance more quickly and further in their careers, earn substantially more than 118,000. But what do we hold, and how do we develop our program so that we have leaders that graduate from our program that are able to more effectively, efficiently utilize resources and take advantage of career opportunities? Is a perspective of population health management. One part coming out of the pandemic, but another part considering how we use resources to serve patients and beneficiaries and markets, to make our organizations move towards achieving their mission and vision, is that we should take a population health management perspective, that the interconnectedness of people in markets and healthcare mean that we should find ways to use the resources to serve individual patients, of course, and their families, but consider the collective effects that manifest in not just clinic utilization or inpatient visits, but emergency room, public health and preventative medicine, and the ability to see the entire patient interaction through all of the aspects of healthcare in our system to get that more efficient, effective effect. So we consider all the aspects of healthcare and the interconnectedness of health systems. Also, tying to the resource perspective is that modern healthcare leaders require an acute and clear understanding of financial models. Gone are the days are moving away from just simply having reimbursement, a common fee for a common service. Is that we're moving into a world where there is a great deal more risk shifting, financial risk, working on a value-based perspective, and finding ways to consider consumerism and the role of the patient and the beneficiary in ways of payment and consideration for partnership in some ways. And so those financial models are evolving, and so we need to train and develop our students to be able to embrace those new elements. Of course, understanding of the information that is available. The old saying is there's data everywhere and none to help me think. So that you need to be able to understand where the data comes from, finding that valid and reliable information, using new technologies, including artificial intelligence and health informatics, to be able to drive decision making. And then the bottom line is that we serve people, we work with people to serve people in communities. And there's three things that people can do in response to leadership. They can either be resistant, they can be compliant, or they can be committed. And so those leaders that tend to be able to clearly convey a way forward that is effective, that is a way that clearly compels positive action, we aim to engender that in our program. That is that we continue, even in this world of artificial intelligence and social media and distance of people and communities, is that leadership matters. And that is to be able to achieve effect within your own organization, but also to lead within a community and within a marketplace in order to be able to achieve the highest levels of population health management. I'm not going to go through each of the roles, but generally speaking, health administrators, folks that are practice healthcare management, plan, organize, lead, and control systems and processes within organizations. And there are a number of health organizations and locations where health administrators work. Generally speaking, if there is an organization that is healthcare providing or healthcare supporting, that has a budget and people and the ability to coordinate activities in an organizational perspective, or for that matter, potentially from an entrepreneurial perspective, you will find health administrators. And so those roles can be at the operational or the executive or the C-suite level. In many cases, folks start off at an entry level or at a mid-level at the operational, being a manager or coordinator, that can work their way to a director or vice president role, or they can consider being an executive at the top level, CEO, president, C-suite, or the owner or partner of an organization. We think that Louisville, Kentucky, and our community is a great learning laboratory. We have a number of major health systems, headquarters for healthcare organizations, and a span of rural, suburban, and then metropolitan healthcare. And so drawing upon those different venues and sources of care provision and leveraging the ability to interact with and provide direct support and have ideas and, again, a learning lab with our partners in the community, we hope that Louisville, Kentucky is a great place to be able to teach our students to draw from the lessons learned in our community, to be able to participate in education and practice in our community. Gives us an opportunity to provide quality education. It's also a great place to work in our healthcare system, serving the folks in the Louisville metropolitan area, Southern Indiana, Ohio, Illinois, and then even down in Tennessee, we have a number of folks that we directly support. And of course, we have Cardinals all across the country and the world. We see our students working not only within the metropolitan area, but literally across the world in the federal services, a few entrepreneurs, and a number of our administrative fellows have been able to be placed all across the country from coast to coast. And so this is not an exhaustive list. We're continuing to update the list of where our grads work, but we have placements across the country representing all aspects of healthcare delivery. So our bottom line, and I referenced this early, is that we build leaders. Building leaders isn't a matter of you coming in as a blank slate. We are aware and appreciate and embrace that all of our students come with development. There's no blank slate, and we aim to build that foundation that you bring to our program at any levels. that we build that foundation and we develop competencies. And so we do this in a way that is our view that the best leaders, most effective leaders operate with honor, integrity, and professionalism. We model those aspects and through our values within the program, the faculty and the staff and our school, and that we want a leader, a graduate of our program, to be able to be an organizational leader, to serve competently. You know, we hold that the ability to effectively and efficiently apply leadership and management skills is absolutely critical, particularly in the service of people. In fact, it's potentially even moving towards an ethical to assume a position of leadership or management ill-prepared, particularly when the well-being and lives of folks are at stake. And so we have that. You're in good standing to be an organizational leader serving folks in a healthcare environment if you're competent. And so our entire curriculum is focused on developing competent leaders who are able to go out and to serve with honor, integrity, and professionalism. Hey, just a few notes about our school and our program. Our school is accredited by the Council on Accreditation for Public Health. Our program is accredited by the Commission on Accreditation of Healthcare Management Education. And so this dual accreditation for C for public health and CAHME for healthcare management is a very valuable. It shows a direct and a commitment to quality education. And among the 158 accredited programs in the United States and Canada, our U of L MSHA is currently number 46. You know, we're in very good company, a lot of longstanding, multi-decade long programs. We're not satisfied. We particularly on the drive of our students and our recent alumni, we see the opportunities to continue to move up the ranks and to be able to represent our school, but also to advocate for our current students and our alumni by showing the excellence that we have and continuing to maintain this commitment to excellence through our accreditation. And so that curriculum, the courses that are required for graduation from our Master's in Science and Health Administration is predicated on the National Center for Healthcare Leadership Competency Model. These are key competencies that were developed by the American College of Healthcare Executives, the Association of University Programs of Health Administration, healthcare systems across the country to identify those core competencies that a competent leader of a healthcare organization must have. And so each one of our courses in our 43 credit hour curriculum directly provides development and then evaluation of all of the competencies within that model. We also include a population health leadership competency that extends our emphasis to be able to serve whole markets and whole communities. And so that 43 credit hours consist of 15 courses. 14 of those courses are 3 credit hours. There's a single 1 credit hour leadership seminar. We offer courses in an 8-week mini terms. And so generally speaking, most universities have a fall and summer or fall and spring and then a summer term. The mini terms of our online MSHA was designed for working professionals, folks that can concentrate on 1 or 2, perhaps 3 courses at a time, rather than having 4 or 5 courses simultaneously in a drawn-out semester. And so the schedule of courses that we have is that all courses within the 43 credit hour MSHA are offered during the academic year. We have a fall 1, a fall 2, a spring 1, a spring 2, and summer. The program as offered now for the online MSHA has no required practicum. And so one of the admissions standards that we have or guidelines is that students come with organizational experience. We are developing a pathway so that students that do not have any organizational experience or perhaps just a year or less, they will be able to be admitted into the program and they would be able to have that experience through a practicum. But currently our admissions for our program, if you come with organizational experience, you're admitted to the program and you're not required to complete a practicum. So that list of courses, the fall 1, fall 2, spring 1, spring 2, and summer. I have a note there that we also offer the 690 capstone course in the fall for those students that would aim to graduate from the program in the fall. But the general schedule is that we offer 3 courses each of the 8-week terms. A typical student will take 1 or 2 courses per 8-week term and graduate in a 2-year period. There are processes that can be applied where a student could take additional courses beyond the standard one or two courses and complete the program in an expedited basis with permission from the graduate school for overload enrollments. And we can tailor an enrollment plan for each student that matches your interest to graduate. In terms of time, you can have up to 5 years by the university's grad school standards. Potentially, a student could graduate from the program in as little as 17 months by matriculating in the fall and completing a regular term of classes through the first year, and then finishing out, as I noted, in the fall through a capstone course. All right, we also offer 3 graduate certificates in healthcare management, healthcare financial management, healthcare quality, and project management. There's a couple of reasons we offer these healthcare management certificates. One is it's for people that perhaps want just-in-time training and development or continuing education development, that perhaps you've recently moved into a role in which quality and project management or financial management or just a general healthcare management refresher, or to learn more about this discipline, is best served with a graduate certificate. And in that case, we have 2 or 3 12-credit courses or 12-credit graduate certificate programs that students can possess. The other element is that some students may wish to pursue a certificate first, and then if they want to extend beyond the first certificate, apply to the full MSHA. All courses within each of these certificates can directly be applied with a grade of A or B to the MSHA program. Admission to the MSHA program and any one of those graduate certificates are separate actions. And so if an individual were to pursue, say, for instance, the healthcare financial management graduate certificate, to apply, be admitted, and to complete, or on the cusp of completing that graduate certificate, and then wanted to transition to the full MSHA, then they would apply secondarily to the MSHA and separately. Let me just say this in general, that the first element of why we started these certificate programs is either continuing education development. Maybe somebody already has a master's degree, or even they're a provider with a doctorate, and they wanted tailored, focused development in one of these areas of general management, financial management, or quality and project management. That is the primary reason. If folks were interested in more than one graduate certificate, I honestly would advocate just attend the full MSHA. A person who earns the Master's of Science in Health Administration degree from a CAHME accredited program, our program, you don't need the certificates. The master's degree speaks for itself. But if you're not sure, you could take one of the certificates, complete it, get a sense of the rhythm of the courses and the content of the curriculum, and then go to the full degree program. All right, a couple of highlights, and then we'll close out with the Q&A session. Our program is very interactive and connected to the American College of Healthcare Executives. It is one of the prime professional organizations in the United States, along with the Healthcare Financial Management Association and the Medical Group Management Association. There's also the National Association of Health Service Executives. But ACHE, and particularly the Kentucky chapter, provide a great deal of support for our students, guest lectures, opportunities for scholarships, opportunities for travel funding to attend the annual American College of Healthcare Executives. This year, that annual meeting is going to be held in March in Houston. In years past, it's been Chicago. Next year, 2027, we held in Nashville, and it's a meeting of 5,000 to 6,000 healthcare executives from all across the country, dedicated to attending continuing education development seminars, networking, and also a great deal of we have alumni activities. We have our program has a meeting with the Kentucky chapter, and students and faculty from other graduate programs in our state also attend. So a great opportunity. ACHE also provides a basis to ensure that our curriculum remains current and is appropriate for current and foreseeable problems, challenges, or opportunities in the marketplace. Our students are very active in case study competitions and graduate essay contests. In fact, just a few weeks ago, students in our online program participated in the Penn State case study competition. We're semifinalists. We had a group of students online that competed in the National Association of Health Service Executives conference and case study competition. Those folks performed very well, didn't make it to the semifinal rounds, but there's great prospects for the next round. And so in these case study competitions, if there's any travel or registration required expenses, the program will cover those expenses for the students that participate on site or attend or participate at a level of virtual, but with registration fees. And here's the thing. Students that come in first, second, third, fourth, or fifth, or that particular competition, if you win show or place, you get to keep the scholarship dollars, or any, of course, there's any hardware that's received. We support these developmental opportunities, the case study competition. In fact, the graduate essay contest for the Stoll essay contest with ACHE, Rachel Perrell won the national essay contest representing our program a few years ago. We do this because we want students to be able to go out with colleagues, with peers at other graduate programs and compete. It's both developmental and it's also a bit of evaluation to see how you stack up. It's a little bit of training and education, working a case analysis. There's also an opportunity to network for career development. The judges of these case study competitions are often healthcare executives. They themselves have been past MSHA or MHA students, and they're current healthcare executives, and they provide feedback and opportunities to get some real world authentic assessments, following the case perspective. And so we've done well, and we continue to provide those development opportunities. It's not required. It's almost like an intramural type of activity that's considered to be developmental. Because our program is CAHME accredited, our students and by extension, our alums are eligible to apply for a number of administrative fellowships across the country and in our region. An administrative fellowship is a postgraduate developmental opportunity for a period of 1 or 2 years following graduation, in which a hospital or health system or medical organization will provide a series of projects and mentorship from a senior healthcare executive to extend the development from a graduate program. And it's generally focused on some post-fellowship utilization assignment. So, for instance, a student may be hired as an administrative fellow at the Medical University of South Carolina Health System, and for a whole year or 2 years, they'll work a series of projects and be mentored, attend conferences, symposiums that are focused on enhancing access and family practices within a health system. And so it would follow that after focusing on medical group practice or primary care access for a year or two through fellowship projects, that their first assignment may be to be director of primary care at one of the major areas for that medical university system. And so administrative fellowships are postgraduate developmental opportunities. There are 200 or 300 of these opportunities throughout the country. We've had placements every year in our program for the past 7 or 8 years. Most recently, Sydney Durban was selected for the UK Medical Center Administrative Fellowship, and we've had there's still a few more students that are waiting for their final interviews. And so happy to talk about that more in terms of opportunities, but it's a postgraduate opportunity immediately following graduation. Look, our faculty are all doctorally educated. Many of them are former healthcare executives, board certified. We have executives and residents. They are former healthcare executives that are on our faculty and staff that serve as advisors and guides for career development. They often will provide guest lectures, and they serve on our advisory board. We're very tied to the Commission on Accreditation of Healthcare Management Education. Myself and Dr. Andrew McCart are both CAHME fellows and designated accreditation specialists. We are in our role, we go out to other programs and provide accreditation activities, which gives us a chance to see best practices and also see opportunities and where we want to avoid bad outcomes. But the thing is that participating in the national community of accreditation and through the Association of University Programs of Health Administration is that we want to be participating members of our healthcare management education community, which helps inform how we develop our curriculum, replicate best practices, and then show the great things that our students and our faculty and staff do that would be intended to continue to elevate and improve our rankings among peers. I noted we have the 8-week terms, fall 1, fall 2, spring 1, spring 2, and then a summer 8 weeks. It's concentrated opportunities for learning. The fall 1, fall 2 are back to back. Our weekly schedule for 8 weeks is that week 1, day 1 is Monday. Day 7 of a week is Sunday. And so on a Monday through Sunday schedule, you have these 8 weeks between fall 1 and fall 2, spring 1 and spring 2. There's no spring break. A student would basically go through, take fall 1 classes, and on week 8, day 7 on Sunday, the next day they would start day 1, week 1 of fall 2. The same would happen in spring. Where there are breaks in our program is between fall 2 and spring 1. Students, practically speaking, have the whole month of December and the first week or so of January that is available. And between spring 2 and summer, there is the month of May. June and July are dedicated to the summer 8-week, and then students have about 3 weeks in August to take courses. I mean, you can do the math. We have 5 8-week terms, so that's 40 weeks. There are 12 weeks that we don't have classes broken up through the year. And again, depending on your life, professional circumstances, any one of those 8-week terms, a student can enroll in 0, 1, 2, or 3 courses, depending upon their schedule, your resources, what's going on in your life, in your job. You have flexibility to either mash on the gas or tap on the brakes in terms of enrollments. And we're in the process currently of updating all of our coursework for 26-27 that we are going to enhance the level of artificial intelligence, analytic thinking, and population health, to build and to extend the quality of our education that incorporates the most latest trends and management decision making. All right, I'm going to close out this session. We've got a QR inquiry form if you've got if you have your phone or ability to capture it, or we'll save these as well. I'm the program director. You can always email me, lee.bewley@louisville.edu. Our director of student recruitment is Deepti Jain, and our admissions counselor is Jennifer McLean. We have one current matriculation to our program. Students start the program in the beginning of the fall semester in August. And so we accept applications throughout the entire year. We don't sit on them. If you submit a completed packet for admission, it'll go through our department to the program. Someone will reach out and schedule an admissions interview. The admissions committee, which is generally myself and another faculty member, will sit for the interview with you. The nature of that interview is really about fit. If you have the grade point average, we're looking for a 3.0 or higher. If you have a GPA between 2.5 and 2.99, you may still be admitted to the program, but you could very well be admitted on what's considered a conditional basis. And the condition is that in your first enrollments in the program, generally the first 9 hours of enrollments, that you would earn a 3.0 or higher. If you do, then the conditional admission turns to full admission. If in the event that you were not able to maintain the 3.0 in your first enrollments, then that condition would be voided. In almost all occasions, individuals that are admitted on a conditional basis are able to resolve that issue. The 3.0 is actually the requirement to have a degree at the University of Louisville. So those things that we look for in the admissions interview it's all about fit. Practically speaking, once a student is admitted to the program, and they show a clear commitment to health administration, they see a clear career path, and they show that, look, what we're offering here at the MSHA program is what you're seeking. And of course, you get a chance to interview us as well. You want to make sure that what we're providing is what you're looking for. And so that's the nature of that interview. We also require a resume or CV. We're looking for your experience and your background, your full transcripts, letters of recommendation, or the graduate school has forms that you can give to for those letters, that they can simply complete a form, checking the levels of their observation of what your career and your academic potential are and your experiences, or they can write a simple letter of recommendation, transcripts, resume, and references. All right. This note, being admitted sooner By March 1st, the graduate school, the university has a number of scholarships for graduate students that are available. If you're admitted earlier, you should be able to apply for those scholarships. It can also help coordinate in terms of your class scheduling. But on the other hand, if a student has a working application by July 1st, we will hold those admissions interviews, and all things being equal, we have a slot for you if you are a qualified student, you meet all of our admission standards, and you're clearly committed to career and healthcare leadership and management. There's a spot for you in our MSHA program. All right, folks. That closes what I wanted to cover in terms of key information that a number of students or prospects have asked us about in the past. I'm going to close out this section, stop the sharing. And if you have any questions, I'm happy to answer them. You can either open up your mic and answer directly, or you can type it in the chat box. Let me know how I can help.
Well, thank you, Dr. Bewley, for the presentation, and forgive me, I'm in a Panera right now, so forgive if you hear the background sounds. But one question I have is for the courses, I guess specifically the health information system course. Like how, I guess I'm just curious what the nature of that is in the sense of like how detailed it is. If it's sort of like a just a general overview type thing, or how detailed it gets.
So I don't teach that course. Dr. Andrew Picard and Dr. Scott Skinner primarily teach that course. Oh, look, I'm the program director. I'm only saying this because it's not my prime course. But what we see and what we're attending is that it's one part a general overview of how health organizations follow a systems process for organizing data, processing the data to drive management decision making. I know that Andrew McCart incorporates a lot of business decision making, in terms of like how you evaluate technologies, how you incorporate information into decision making. And then there's sort of an integrative experience it's not like identify the different, like what's the parallel approach versus the switchover approach in terms of technology. He'll mention that, but it's more from a leadership or management perspective, how do you use systems in order to be able to drive decision making? And I think that it's one of the things that I was alluding to, that both Andrew and Scott are focusing on incorporating a little bit more artificial intelligence of how that new element is more than just super Google. How do you use that technique and with an emergent perspective to enhance decision making, either in terms of the quality of the decision or the speed in which information is developed so that you can make that decision as a human being.
Awesome, perfect. And for all the classes, like how much time in a week should someone dedicate? And I know it depends on how many classes you're taking and
yes, sir.
Stuff like that.
So how many classes you're taking, but let's just stick with a single course. And I'm going to say it depends. Look, if a student had a great deal of experience in a particular, like let's say their undergrad was accounting and finance, when they take the healthcare finance and accounting course, they probably will recognize balance sheets, income statements. But what they might not know is how healthcare is financed, primarily through employers, through taxes collected, which is materially different than most organizations. On the other hand, I'm just trying to think of a course, like maybe you've never had an economics course ever. And so when you take that economics course, new concepts and principles, learning healthcare. So in those two cases, I'm going to say this: for a 3-credit-hour course, a student should probably expect to spend at least 3 to 5 hours of reviewing the material, the PowerPoint slides. We embed videos either that our faculty have made themselves, like hi, I'm Lee Bewley. This week we're going to cover the concepts of moral hazard and knowledge asymmetry. So these are key elements, like 5 or 10 minute video. So 3 to 5 hours of material. Not all weeks would you have a major deliverable. Usually we'll have a midterm and a final exam, and so there's a bit of a tempo. At least an hour, but if it's a major week, 3 to 4 hours developing a tempo. So at most, maybe 5 to 10 hours per course, but at least 3 to 5 each week for a single course. And so, the general rhythm that I've observed on the receiving end as a professor, but how we design the courses for working professionals is that there's a reason for that Monday through Sunday cycle is that most people still work a Monday through Friday or a Monday through Thursday schedule. Is that come home and you would spend a few hours, knock out, what is it that one of my buddies says, inch by inch, life's a cinch, yard by yard, life is hard. Is that if you do a little bit each of the work week, at least 30 minutes to an hour each night after you come home or when your work schedule is over. Of course, you want to have family time, but then that weekend when you generally have more time available, you can close out and submit all of your deliverables. Most every week, the prime way that in graduate education for online programs is there's usually some type of discussion board. And so what would happen is that typically this is the format. There's some content or material that's presented to you, either from the professor through a recorded video, through we'll have TED Talks. We'll often have like a chapter reading. We'll have a journal article. Is that you review that material and then there will be a weekly discussion question where we'll identify a key concept, principle, or competency that is the focus of our attention. We'll ask like an open question. This week, like I used an example of moral hazard and knowledge asymmetry. In your experience or in your view as a healthcare consumer or as a healthcare manager, how might you see the concept of moral hazard impact decision making and the purchase of pharmaceuticals? And so you would give an example, another classmate would respond to your example, and you go through a discussion. Then you receive feedback from your instructor. So most every week there's some type of discussion board that basically takes the place of an in-class discussion. All of our online MSHA classes are online and asynchronous, which is to say that you will never in our program have the whole class be told, hey guys, we're all going to meet at 5 o'clock Eastern Standard Time, be there. Now, occasionally faculty members will have voluntary Microsoft Teams sessions for like something like statistics, or if there is a guest speaker that we might have for the program, it'll be just like this information session. We'll have it live for everybody who can attend, but we'll record it so you can have that access. The only time in our MSHA program where you will have an online synchronous session is one-on-one between you and the faculty member, and that's not for every course. For instance, in my strategic management course, students work on developing a strategic plan through the 8 weeks. And then at the end of the 8-week period, I schedule like a 15-minute Microsoft Teams session where I'm like, okay, Sue, Bob, how did the analysis go? I see the work that you put together. I have a few questions for you. We schedule that at a date and time that makes sense to you, and you would never be like it's one time, it's always coordinated. And then at the end of the program, we have a MSHA capstone. The MSHA capstone is case-based, which is to say that there's a case. I told you about the case study competitions, but we have a case analysis. Students are broken up into 3 to 5 person groups. They can communicate, using Microsoft Teams, or they divide up into discussion board groups. And then at the end, they convene at a time that's convenient to them to record a video presentation. And then the final capstone deliverable is a comprehensive oral examination, which looks a lot like a job interview. Again, scheduled at a date and time that final week of the semester and the final graduation semester, it's one-on-one with either myself as the capstone instructor or myself and a colleague, and we ask you questions in which, quite frankly, there are many right answers. We'll put you in a problem, scenario, or opportunity situation like, Fred, congratulations. Your first job out of the MSHA program is you've been hired as the director of strategy for a medical group practice. This medical group practice has never had a strategic plan, and the owners of this plan want you to develop a strategic plan that focuses on opportunities. outline how you would set up a strategic plan for this group practice. You know, that's the kind of questions. And Mitch, there's many right answers, but we just want you to be able to integrate knowledge and then demonstrate that you can apply the principles, concepts, competencies in the program. All right. Great question.
Awesome.
I like what we do. And look, the nature of our program is it's not just about completing a bunch of classes and getting the credits. Every course is important. And that's the cool thing about grad school. I mean, undergrad is fun too, and it's great. But what I mean to say is when you get to the master's level, this is what you're focused on in your career. And so that's why we're looking for fit. If someone wants to be a health administrator, every single course in our curriculum will help you in a way that when you go out as an organizational leader, you should be able to draw from every course. There's nothing that's sort of like filler, like, oh, in fact, there's no electives in our program. These are the courses that are tied to competency development. All right.
Yeah, so I have some more questions, but I don't want to dominate.
Sure.
I'll let Jesus and Mackenzie ask if they have they have a question.
Do y'all have any questions? Or?
Hi, Dr. Bewley. I actually did have one question. The question that I was going to ask, sorry, I didn't know if my mic was working. You might have touched on this in your presentation and I might have missed it. With the requirements online for the program, how, like, I guess I should say, like, the expectation for the 5-year experience that it has on there, the professional experience.
We evaluate every student on a case-by-case basis. In fact, I'll say it plainly. Our program is moving exclusively to online. And so the new standards are going to be, do you have at least 1 year of organizational experience? If so, you'll be admitted to the program. If you don't have 1 year of experience, we'll still admit you, but there's a required practicum. So I'll just say it plainly, Mackenzie, if you have between 1 and 5 years of organizational experience, and you have and some of it is healthcare particularly, you have a clear case for admission to our program.
Okay, thank you. I appreciate it.
You're welcome. All right.
All right. Thank you, Dr. Bewley. Quick question. So I actually enrolled in Louisville, right? I'm actually doing my MBA. And I found out it's a dual program, right? Regarding the MBA.
There's dual pathways. The MBA program at U of L will accept up to 3 of our courses as the electives that are required, and that there are a few courses within the MBA curriculum that we can give you credit if you enroll in the MSHA.
Okay, copy. Because I'm trying to pursue. I'm finishing this coming summer, right?
Yes, sir.
And actually, I still want to pursue the health administrator, right? Because
I'm tracking. So what we would do is, as you finish the program, you could be admitted to the online MSHA. We could do in fact, we established the dual MBA MSHA. We've got a good sense of the courses that you're taking, and you can have up to 9 hours or 3 of the courses the thing is that most of the MBA classes, I don't think, depends on which version. I think that they have a combination of credits, like there's 1.5 hour credits, is that in some you can have your MBA coursework count towards the MSHA, but we work with each student on a case-by-case basis. But up to 9 hours of the MBA can be counted towards the MSHA. And then, of course, if you're enrolled at the same time, and that was what we were aiming for, is that students could have the 9 hours of the MSHA count to the MBA. So we definitely have that intent, and the curriculums are mutually supportive. Like there's concepts and principles that you're going to learn in the MBA program. The difference in the MSHA is that we extend those concepts, like Porter's 5 forces and strategy. We show you how the Porter's 5 forces works in the healthcare environment.
Perfect, tracking. Yeah, because I actually next semester I'm starting with the certificate, right, of business of healthcare.
Business of healthcare.
Yes, sir. And then I'm just looking forward, because I was previous military. I needed to get out due to personal situations, right? But I'm trying to get back as a healthcare administrator for the Air Force. And that's what I'm looking forward to do both.
So that's what I'm tracking with what you're saying, is that the Navy and the Air Force both have clear pathways for graduates of CAHME or CEF accredited programs to be directly commissioned in the Medical Service Corps. I am retired. I'm a retired Army guy, and so I know that the Army will send you to OCS, and maybe you might be Medical Service Corps. But our friends in the Navy and the Air Force, if you come with a CAHME accredited health administration degree or from a CEF accredited school, you can compete directly to be placed and branched in medical service, which gets you to health administration and leadership in the military health system.
Okay, perfect. So it's still the same process, right? I need to do the letter of recommendations, all the stuff before.
I would say this though, if you, I don't want to, we could maybe do it offline or link up directly, like during the duty day or something. But I would say that if you want that pathway for commissioning, and I don't want to prescribe too much, but if you have time and credit hours, you don't necessarily need the business of healthcare certificate. You could transition to the MSHA to get you to where you want to go. The content of the healthcare management, that business of healthcare is good content, but it would be somewhat redundant to taking the MSHA, particularly if you want to be commissioned.
Right.
Their School of Business is well accredited AACSB, but unless things have changed in the Navy or Air Force, I think that they specifically look for CAHME or CEF accreditation, of which our school has both. Hey, there you go. There's already a Cardinal community building here. Thank you, sir.
Perfect. Yeah, because I was looking forward to it, but that's why I joined, to get more information about it.
Okay, happy to help, and I've got a lot of my time in the military. A lot of buddies and a lot of classmates in my grad program, both Air Force and Navy Medical Service Corps officers. In fact, my roommate from college, Eric Hyde, was a Air Force Medical Service Corps officer, retired a few years ago.
Nice. Well, I appreciate the time, sir.
You're welcome. Happy to help. All right. Any additional questions?
Yeah, Dr. Bewley, I was also an Army MSc as well, and then so I saw your 47 cash flag in the back. That's awesome.
My doodles.
Oh, and the dogs. There you go. And I guess speaking of the military, how much does the program touch on the military health system and also as well as Centers for Medicare, Medicaid, and or is it and civilian healthcare? Is it sort of agnostic to all those and talk some generalities, or do any of the classes deep dive?
Truth of the matter is, it's more agnostic. I don't want to. I'm not going to give you a smoke show and say, oh yes, of course. No. There is a clear view of the federal health system, that includes Indian Health Service, Centers for Medicaid Service, the military health system. All of the federal systems interacted within a system of systems, and so we give a broad view so that you understand the United States healthcare system, and then you can place it. Those core competencies you can apply throughout the systems. Now, let me just say this, though. When you're in the classes, if you're currently on the team, military health system or the VA team or Indian Health Service team, or you worked for the Medicaid program in Tennessee, you can use, that's the beautiful thing about cross-pollination of ideas and perspectives. You can use your own working situation for your homework assignments, your discussion board, and you get feedback from your faculty member, but you also get feedback from your colleagues, and you give them an insight into what you're working. And so we strongly encourage folks to use their current working or their past working experiences to illustrate how you would apply the concepts and principles as a health administrator. It's sort of like a learning lab to have that effect.
All right. And one of my main questions, I should have let off with this, but I know in the online website I saw, it said active duty military has a discount of, I think, $250 a credit hour.
Yes.
Does that apply to reservists and National Guard, or is it just active duty?
Potentially. Look, I'm not the bursar, and I don't mean to I don't want to just stuff off there, but my sense is that I don't know if you're using your GI Bill, or depending upon the education program of your office. There are folks that are AGR, active guard reserve. And if you're using your military medical benefit, Carissa Gentry is our point of contact at the university for all military affairs. She's the key point of contact to determine whether or not you qualify for the 250 rate. Or if we accept whatever the GI Bill pays. I think there's like a yellow ribbon type of program to be able to provide that. But the university's intent is that for our military service members, GI Bill utilization is that we find that the competitive rate in the most cost-effective way as possible. But I can't control the rate. But I'm happy to share it so that folks can be able to get a great education that's well earned.
Awesome, thank you.
You're welcome. All right. Wow, 6:50 already. Hey, any additional questions or things I can do to help? And I'm going to say this, lee.bewley@louisville.edu. If you have any follow-up questions, please email me. If you'd like to link up, for a one-on-one, we'll set up a Microsoft Teams meeting or a phone call now or a month from now or whatever, prior to the July 1st deadline. But also, if there's anything I can do to help in general. I am retired Army. I'm a professor. I have a great life and a great service, and I'm always happy to help others and to pass it down because I've had a lot of help and guidance myself through the years and do my role. All right. Well, I'm going to put one final call out. Any questions that I can answer for this session? Again, we have it recorded, so if folks wanted to go back and review the slides, it's available to you. I'm happy to answer any questions or provide any help or assistance along the way. And in general, if there's anything I can do to help, please let me know. All right. Well, you all take
perfect. Thank you, sir.
You're welcome. Take care. Have a good evening
Bewley.
and happy Thanksgiving in advance. Have fun. Be able to thrive with your families and rest a little bit. It's well earned. You all take care.
Sir, have a good one.
You too. Thank you.
Thank you.